Hi guys, it's Miss Medic here with another rheumatology video. Today I'm going to be talking about osteoarthritis. What is the most common arthritis? Well, in actual fact, it is osteoarthritis. It affects the cartilage between bones, resulting in damage to the cartilage and leading to a reduction in joint space. Cartilage normally acts as a shock absorber, and in healthy patients there is a normal balance between cartilage damage through wear and tear and new cartilage being produced by chondrocytes. Damage to the cartilage exposes the underlying bone to increased stress. This bone tries to combat this but overgrows at the bone margins, producing osteophytes. So what are the risk factors for osteoarthritis? There are mechanical risk factors such as obesity, which increases stress on the cartilage, and weight-bearing joints are more affected, for example the hip. Risk of osteoarthritis increases with age, and people with joint damage or a family history of osteoarthritis are at increased risk. What are the symptoms in someone with osteoarthritis? Well, the key joints affected are the hip, the knee, and the base of the thumb. At the base of the thumb, we have a carpal metacarpal joint, which is particularly prone to osteoarthritis. The two key symptoms of osteoarthritis is joint pain and joint stiffness. Key questions when asking about pain in this particular setting is there any particular time of the day when the pain is worse, and is the pain affected by movement or exercise? So the pain of osteoarthritis will be worse at the end of the day and after movement. You should also ask questions about joint stiffness, like what time of the day and for how long. In the clinical exams, you may be asked to carry out a musculoskeletal examination, and this involves looking at the joint, feeling it and moving it. With disease progression, night pain can be a feature of osteoarthritis, and in osteoarthritis joints are often asymmetrically affected. So what are the signs of osteoarthritis? Well, the signs include Bouchard's and Haberdin's nodes, and Bouchard's nodes are in the PIPs and Haberdin's in the DIPs, and this can be remembered by thinking alphabetically. B comes before H, so therefore the Bouchard's nodes are in the PIPs and the Haberdin's are in the DIPs. And in osteoarthritis, DIPs tend to be more commonly affected than the PIPs. Patients with osteoarthritis tend to have crepitus, which is a crunching noise when moving the joint, and that's why in your clinical exams you'll be asked to look, to feel and to move. So when you're moving, say a knee for instance, you might hear a crunching noise, which is crepitus and evidence of osteoarthritis. Patients may have effusions, muscle weakness and muscle wasting. And what are the investigations for osteoarthritis? Well, you would do an X-ray, and as a response to osteoarthritis, as we talked about before, new bone is laid down, and this causes sclerosis. Also, new bone is placed down at the joint margins, and this creates osteophytes, and the synovial fluid becomes thickened. This is known as joint effusions. Subchondral cysts occur due to microfractures of the articular surface, and there are 4 changes on X X-ray, which can be remembered by the mnemonic LOS, and these are what I've spoken about, the responses of the bone and the cartilage to osteoarthritis. So L is for loss of joint space, O is for osteophytes, S is for subchondral cysts, and the second S is for sclerosis. So how can osteoarthritis be managed? Well, patients should be educated. They should be advised on weight loss, as this will reduce the load on the cartilage. First line drug therapy is paracetamol and topical NSAIDs, and second line would be a weak opioid such as codeine. Third line is the use of oral NSAIDs, and this is best when prescribed with a proton pump inhibitor to protect the patient from developing gastric ulcers. And finally, in severe pain, you would give intra-articular corticosteroid injections, and then ultimately, if these are not effective, surgery would be then implemented. So that concludes my presentation on osteoarthritis. If you enjoyed this presentation, don't forget to like and subscribe to my channel.